Now, the very final stage of memory in the Atkinson and the Shiffrin model is long-term memory. And in many ways, you might argue that you know ultimately what we want is to hold on to important information for long periods of time, so that we can then draw on it later on in order to produce intelligent behavior. Now, long-term memory really comprises anything from the 15 seconds classically that you can hold on to something in short-term memory without rehearsal, possibly all the way to a lifetime. And indeed, both the duration and capacity of long-term memory have never been or rather, we've never quantified the existence of limits in both the duration that something can be stored and the amount of items that can be stored in long-term memory. And finally, we're going to discuss this again a little bit later, but long-term memory seems to operate according to a semantic code. You'll remember that we said that short-term memory seems to encode information auditorily. So for example, if words sound similar, in short-term memory, you are at risk of confusing them, which reveals the auditory code of short-term memory. Long-term memory, on the other hand, seems to have a more semantic code. So information in long-term memory seems to be organized according to its meaning. Now, these are two interesting constructs, but an important question is, are they actually different? Is there evidence to suggest that short-term memory and long-term memory are actually different in the human mind? And from one point of view, you can observe that they certainly have different characteristics. The amount of information that you can hold in each is extremely different. Short-term memory has sort of certain for visual and for auditory, acoustic. Short-term memory has sort of a firm and fairly small amount of items it can hold. As we said, long-term memory potentially has an infinity of items it can hold. Short-term memory tends to have a quick decay, so you lose it very quickly unless you rehearse it. Long-term memory, you might encode it, keep it there, not think about it for the next 5 years, and then suddenly retrieve a memory you just hadn't thought about. So it's available to you, as I said, potentially for a lifetime. But also the way in which information is encoded. In short-term memory, information tends to be encoded with the physical modality or details of how you've perceived it in the first place. So if it's an acoustic thing, if it's a verbal, if it's a sentence, you're encoding it in this acoustic format. So you're really rehearsing the auditory aspect of what you heard. If it's visual, you're actually probably viewing, quote unquote, in the eye of your mind, the physical stimulus that you've encoded. So in the sense, short-term memory is very close to the features, to the physical features of the stimulus that you've encoded. On the other hand, long-term memory doesn't seem to have this property. On the other hand, it seems that its representations in long-term memory are abstracted, and as I said earlier, are semantic in nature. They don't necessarily retain the physical form in which you've initially received and processed that information. You might remember the physical details of something. So you might see a certain object that it has a certain color and things like that. Now, you'll remember that it has these physical properties, but you're not storing the information in that physical manner. And one proof, the book gives a very interesting observation or example. But whereas if you had two people listen to a list of words and then repeat it, so short-term memory task, they would probably give you back the exact same words, and they would make similar mistakes if words sounded similar. On the other hand, think of doing somewhat the equivalent of this in a long-term memory. Maybe you tell people to you read them a passage, and you tell them, you let them rehearse it so that they put this in long-term memory. And then you have them come back 2 weeks later, and you ask them, what was the contents of the passage? They're not going to repeat word by word the passage. which is instead what happens in short-term memory, they will rather probably tell you the gist of what the passage was about. So they knew the meaning of it, but they forgot entirely the format within which it came in the first time. So again, short-term memory being sort of sensory and so acoustic, for example, in nature, whereas long-term memory appears to function according to a semantic code. Now, that was sort of a behavioral observation in terms of the characteristic of the two memories. But there's really intriguing data from the neuropsychological literature to show that long-term memory and short-term memory actually dissociate. A couple examples. So amnesia is one such example. Now, amnesia is something that often happens or sometimes happens after either brain injury or trauma. And it's something that tends to severely impair long-term memory. And there are two forms of amnesia. There's retrograde amnesia, which is when you forget events prior to a certain the cause of the amnesia. So, for example, people often report that they forget the events that happened shortly leading up to, for example, a car accident. Typically, sort of there's a period of blurriness of what happened just before the accident, and it tends to be graded in the sense the closer you get to the accident, the less the memory or the foggier it is, and then slowly as you go far away, further back in the past, memories become less and less foggy, and then you tend to remember sort of from a certain point on, looking backwards, you tend to remember. On the other hand, you can also patients can also have anterograde amnesia, and that is when patients stop making new memories after the event that led to the amnesia. So typically, these are cases where somebody suffers some kind of brain injury, and then from there on, they lose the ability to form new memory. So this is anterograde amnesia. And now, two extremely famous cases. One is the patient HM. Now, patient HM had a very severe anterograde amnesia after surgical resection of large parts of the bilateral medial temporal lobe. That's where the hippocampus is. Hippocampus appears to be extremely important for creating memories. Not quite for storing them. That probably happens out here in cortex, but for creating new memories. And so HM essentially stopped making new memories from the day of the surgery. And from that day on, for example, he would look in the mirror and be extremely surprised that he looked older than he thought he would have looked. The president of the United States was the same president for the rest of his life, as far as he knew. That was the president when he had surgery. He never learned the new place where he lived. He only remembered the old one, etc., etc., etc. Now, interestingly, his short-term memory was fine. You could talk to HM and have a perfectly fine conversation, at least in terms of short conversations. HM would have enough short-term memory to hear the words that someone would speak to him, and to understand those words and to make sense of them and to respond appropriately. Then, of course, he would leave the room or go look at the window and come back and forget that he had ever met you, at least in a overt way. There might be his implicit memory, but we will get to that later, seemed to be just fine. So his ability to perform skills, things like riding a bike, those he could still acquire. Which speaks to a different dissociation, the dissociation between factual knowledge or declarative memory and the skill knowledge, which is one type of non-declarative or implicit memory. But back on track, a second case is Clive Waring, and there's a wonderful video that I have linked inside your textbook. It's a special about Clive Waring, very touching, but also extremely fascinating from a scientific point of view. Now, Clive Waring had extremely severe anterograde and retrograde amnesia due to encephalitis. And so he would remember nothing about his past. He would be unable to make new memories. He had some islands of memory. He remembered his wife, for example, but beyond that, he remembered very little. Um, he knew he had children, for example, but he struggled. He wouldn't recognize them. He knew that he was a musician, that he worked for the BBC, but he didn't remember any events of working for the BBC or having been a musician. These are things that he kind of knew, but didn't have any. He couldn't conjure in his mind any memory of any of that. As I said, he wouldn't make any new memory. Nonetheless, again, his short-term memory seemed to be just fine. Again, you could have a conversation with him. He'd be very witty. He'd be funny. He'd make jokes. He would respond in appropriate ways. But of course, the second after, it would all be gone. But again, his short-term memory seemed to be fine, and his long-term memory was severely impaired. And perhaps one of the most fascinating aspects of Clive, which is worth pointing out, and this is a recreation of a page from his diary. Imagine this. You have no memory of your past. You have no trace, no overt trace that you don't remember the story of you, and you don't make any new memories. So you're forever stuck in these 7 to 15 seconds that are the present, that are your short-term memory. And so he would wake up every morning and say, I'm alive. For the very first time, I'm conscious. And then, he'd get distracted, do something else. He'd go back to his diary. He would see that sentence. He would cross it out and then say, now, for the first time, I am really alive and really conscious. And he would repeat this very often. He'd always say, I was completely unconscious until now. The two of you, you're the first people I've ever seen in my life. He had very severe retrograde and anterograde amnesia. But again, short-term memory for both Clive Waring and HM were intact. So it is possible to have an impairment of long-term memory without an impairment of short-term memory, which obviously speak to the fact that these two are probably different systems in our brain. On the other hand, you can also get the reverse, meaning you can get impairments of short-term memory, even if overall it's a less frequent combination. But you can get impairments of short-term memory without impairments of long-term memory. For example, patient KF, following a motorbike accident, acquired a severe impairment of short-term memory. In fact, his digit span, if you give him a list, he could at most recall 2 chunks, 2 items. Nonetheless, he could still apparently form long-term memory. So he had an impaired short-term memory, but a functioning long-term memory. And similar for Alzheimer's disease, even though obviously the most prominent feature in Alzheimer's disease, or impairment rather in Alzheimer's disease, is the loss of long-term memory. Nonetheless, in the early stages of Alzheimer's disease, it does happen that patients show loss of short-term memory with still a present long-term memory. So this really gives rise to what we call a double dissociation between the neuropsychological basis of short-term memory and the neuropsychological basis of long-term memory, really suggesting that these are two related but separate and independent systems.